Okay, Chapter 5, Medical Terminology. Sorry I have to do this on video. We'll try and go over it a little bit. If you have any questions, bring them on Tuesday to lab. I'll be happy to answer them before lab or after the lab. Alright, so simple question. Why do we need to know medical terminology in EMS? Quite frankly, it's so that we don't sound like idiots. We can communicate effectively with other members, primarily the nurses and doctors that will contact both before dropping a patient off and when we drop them off at the hospital. It also allows us to communicate with our medical director in concrete scientific terms so that they understand what we're talking about, we understand what they're talking about, and when certain patients with complex medical problems talk to us, at the very least we can get an understanding of what they're discussing. Depending on what type of EMT you are, may also allow you to better understand what's going on with the patient that you may start transporting from one hospital to another. It's more defensible in court, so professional documentation, the appropriate medical terms as far as your care is concerned, showing up in your documentation makes it a little bit easier for both lawyers, judges, and a jury to better understand what it is that you are trying to say, and makes you a little bit more believable, makes you sound a little bit more of a professional. As you begin to continue your education through this after you finish this course, hopefully you'll take up a little bit of interest in research and reading up on new topics that occur and the changes that occur in EMS, especially considering how fast everything changes in EMS, being a new field. Hopefully you'll be able to better understand those research topics. Once you really start getting into the medical portion of it as a paramedic, you may be interested in actually reading up on medical journals written for and by medical doctors, PhDs, etc. And trying to read those without a concrete understanding of medical terminology can be quite difficult. Obviously, we're not going to make you medical terminology experts here in this short period of time, but we're going to give you the groundwork, the foundation to try and improve. All right, so to start off with, we're going to talk about some directional terminology so that as someone describes the location of an injury or location of pain or a symptom, you'll be able to better understand it. When we talk about the front of a body, so a patient's face, the stomach, the chest, front of the legs, genitalia, things like that, we're talking about the anterior side or the ventral side. Depending on which textbook you look at, they may use anterior, they may use ventral. They're interchangeable terms. You'll primarily hear me and most other medical professionals use the term anterior to describe the front. Opposite of that is going to be the posterior or dorsal side. Describes the back. So the occiput, the back of the head, the spinal column, the spinal cord, the buttocks, the back of the legs, the heels, those are all part of the dorsal or posterior aspect of the body. Right and left is always described in relation to the patient, not you. So it is the patient's right and the patient's left, regardless of which direction they're facing or what position they're in. When we talk about the term superior, we're talking about anything closer to the top of the head. So that very crown of the head is going to be the best descriptor of the most superior portion of the body. If we want to talk about directionality as something being superior to the head, we're describing the position that a patient might be found in, or the position that someone describes as being more comfortable, something along those lines. You could describe that their arm was found superior to their head. It simply means that they've got their arm over their head. But in normal anatomical position, superior is going to be the crest of the head. Inferior, oppositely, is going to be closer to the feet, closer to the bottom of the feet, or further away from the crest of the head, or crown of the head. When we talk about the limbs, since trying to describe those as inferior and superior gets a little bit difficult, especially when they're in odd positions, we'd like to use two terms, proximal and distal. Proximal is going to be closer to the point of attachment of a limb, and distal is going to be further from the point of attachment for the limb. Keep in mind that these last four terms, so superior, inferior, proximal, and distal, they're all relational terms. To some extent, anterior and posterior are also relational terms, but when I say something is superior, I cannot simply say that a patient's nose is superior. I can say that their nose is superior to their mouth. I can't say something's inferior. I can say somebody's knee is inferior to their hip. Conversely, we can also use the proximal and distal for that last example. We can state that somebody's hip is proximal to their knee, or their knee is distal to their hip. We cannot simply say a knee is distal or a hip is proximal. They're relational terms. They relate one portion of the body or one injury to another or another object. When we talk about going from the middle out or out in, medial means closer to the midline, so that that plane that divides the body left to right goes down the middle of the nose, the lips, the mentum, the sternum, the navel, the genitalia. That line describes the midline. So something that is medial is closer to the midline, whereas something that is lateral is further from the midline. Again, these are two relational terms. Somebody's navel or belly button is medial to their abdominal oblique muscles. You can say somebody's shoulder is lateral to their nipple. Okay, so relational terms, not terms that you can use by themselves. Okay. Then we finally have superficial and deep. Superficial is describing something that is closer to the external surface or the external environment, and deep is further from the external surface or external environment. So I can say that muscle is deep to skin, or the dermis is deep to the epidermis. Vice versa, the epidermis being superficial to the dermis, or the skin being superficial to the muscles. A couple of terms to describe a movement. Anything that is coming towards the core is considered adduction. Anything moving away from the core is abduction. You see that on the right. So as the arm moves towards the core or towards the midline, it is being adducted. Whereas if it's moving away, it's being abducted. When we talk about flexion and extension, the best way to describe it is to describe the joint that is being either flexed or extended. In this example, the elbow is being flexed when the angle of the elbow decreases. So when the arm is completely straight, that angle is approximately 180 degrees. As it flexes, the elbow's angle goes down to 90 or even lower, so the angle is decreasing, therefore it's being flexed. Conversely, if you go from the flexed position to the extended position, or if you go from the angle being approximately 90 degrees to 180, the angle is increasing, therefore it's being extended. The same exists for the knee. When the knee is fully extended or the leg is completely straight, we consider that extension. As you pull the heel back towards the buttocks, that is a flexion of the knee. Keep in mind that flexion and extension can only describe a joint. They do not describe a muscle or a muscle group. There are terms that describe a joint. You can flex your elbow, you can flex your wrist, you can flex your shoulder. You don't flex your bicep, despite what common language might tell us. What you're actually doing is you're contracting or constricting your bicep. You're flexing your elbow. We talked about this a little bit in our last lecture. When we talk about the abdomen, a couple of directional terms that we can use include the right upper quadrant, the left upper quadrant, the right lower quadrant, and the left lower quadrant. We can describe either a an injury or a type of issue as being either bilateral, meaning it's existent on both sides, or it is unilateral, existing on one side. Typically, if we state that something is unilateral, we need to describe what side it's on. So if somebody has bilateral upper quadrant pain, we're saying that they have pain on both the left and right upper quadrants of the abdomen. If we state that they have unilateral upper quadrant pain, that doesn't really tell us a lot unless we say that it's unilateral right upper quadrant pain, or they have a unilateral right shoulder dislocation, something along those lines. If you're going to say unilateral, make sure you also give the directional or the left or right descriptor. When we look at a couple of positions we might find our patients in, sorry, I went a little bit too far there. We're going to describe someone that is either prone, being face down, or supine, being face up. Ideally, we want somebody to be in a supine position. It's very difficult to assess somebody when they're in a prone position. Anybody who's found unconscious in a prone position can be a very dangerous sign because it means that they did not try and correct the potential problems that exist being unconscious in a prone position. The two positions that you see here are what are known as Fowler's position and the recovery position. The Fowler position is someone being slightly reclined, slightly recumbent, with their knees slightly flexed, their hip slightly flexed towards their core. It's basically the position you'd sit in a nice recliner. It's a very comfortable position. It's the most common position that we will transport patients in on a stretcher. In the bottom picture, you see the recovery position. The recovery position is used for somebody who's gone through a seizure, maybe unconscious and not able to self-control their airway, somebody who's vomited and you're needing to help them remove vomit from their airway. Recovery position is exactly how you see it here. Their right arm is placed over their abdomen or chest. The left arm is extended out underneath their head to act as a slight pillow. The right knee or the right leg is flexed up toward the core to provide support and prevent them from rolling into a prone position. This is also known as left lateral recumbent position. Conversely, you can have right lateral recumbent position, which is where they look exactly like you see in this picture, but lying on the right side. All right, to analyze medical terms specifically, you need to understand the 3 parts of a medical term. 4 parts if you include combining vowels, but the 3 primary parts. You have the word root, the prefix, and the suffix. Not all medical terms will have a prefix, not all medical terms will have a suffix. All medical terms will have a word root, and most of the time will have a word root and a prefix, a word root and a suffix, or a prefix, a word root, and a suffix. Some prefixes and some suffixes are also word roots, and we'll discuss the specific ones that you need to know at the end of this video. So the word root is the word that mostly defines what that word is describing. The prefix is a portion that comes before the root word to help describe the root word, and the suffix comes after the root word in order to help describe the root word. Combining vowels can be used. They're vowels that join one or more root words or root words and suffixes. Anytime the word root ends in a vowel, it switches, or sorry, anytime the word ends in a vowel, it typically gets changed to the connector vowel to make it easier to pronounce. So in this example, we see the word cardiomyopathy. Cardiomyopathy describes a disease of the muscle of the heart. And if you look through the words, you can understand how this comes to be. The first root word that we see is cardi, meaning heart. You see the word root myo, meaning muscle, and then the connector vowel O. Because cardi followed by M, cardiomyopathy, or cardi I can't even say it because it's difficult to pronounce. That O is placed after cardi in order to help the pronunciation. It does not change the meaning in any way, shape, or form. Most commonly, the connector vowel that's used is O. Finally, the suffix of the two root words is pathy, meaning disease. Cardiomyopathy, a disease of the cardiac muscle. All right. In this example, we see the word dyspnea, the prefix being dis, meaning difficult or with difficulty, and the root being pnea, meaning breathing. You notice here that the prefix dis ends in a consonant, not a vowel. The root starts in a consonant and not a vowel, and therefore no helper vowel is needed. Dyspnea means difficult breathing or difficulty breathing. Couple terms you're likely to hear throughout the semester. Hypertension. Hyper means high or greater than. Does not mean an increase in. It simply means higher than or high. And tension meaning blood pressure. In this case, hyper is a prefix. Tension is the root word. High blood pressure, hypertension. Hypotension is the exact opposite. Hypo, low, tension, blood pressure, hypotension. Okay? Notice in this case, hypo, being the prefix, ends in a vowel. That vowel is O, so it makes the pronunciation relatively easy. Hypotension. Okay, some more examples. Tachycardia. Tachy being the prefix, cardia being the root word. Tachy meaning fast. Cardi or cardia meaning heart, fast heart, or in this case, a fast heart rate. Bradycardia, on the other hand, brady means slow, cardia means heart, slow heart rate. Okay. Here you see the references in your chapters. 5.8, table 5.8 is the number of common symbols that you'll see. Table 5.9 is a version or a list of all of the word roots you might expect to hear, as well as their combining forms. When we say combining form, so in this example, went too far. In this example here, you see cardia. Cardia is actually the root word. However, cardi, or C-A-R-D-I, is the combining form. So that's what we're talking about there. So that table will show you the word roots and the various combining forms, and whether or not they tend to use a helper vowel. And 5.10 is some common prefixes, 5.11 common suffixes, 5.12 is some common abbreviations, and I believe there's one other table. I don't remember its table number. It's a table describing all the different numbers you might expect to hear, such as 1 being uni, or primi, meaning first or one, dual, duo, or die, or bi, meaning two, etc. All of these will allow you to combine various word roots, prefixes, suffixes, to create the appropriate medical term, or at least break down medical terms that you see that you might not otherwise understand. As best as you can, try and use the appropriate medical term. However, keep in mind, just because you understand how to potentially create a word that you think means what it should mean, if you do not know the correct medical term, don't use it. So in this example, I'd say if I were to ask you about the correct medical term for a toothache, and you didn't know what a toothache was, you wouldn't decide to call it, you wouldn't decide to create the term out of medical terms. You would simply state that the patient described pain in the tooth or a toothache. Okay. Now look at a couple different examples, and just kind of look and see whether or not you feel one sounds more professional than the other. I don't think these are the greatest examples in the world because I don't think they both describe the exact same scene, but one of them uses medical terms, the other does not. But if you, I don't think you can see my pointer. Understand that there are certain terms in here that are going to look bad in a professional manner, especially if it ever gets called to court. For example, had a big old goose egg on the back of her head. A big old goose egg in a legal area, so if it was brought to court or to trial, can be taken literally. A lawyer can try and say, did she have a goose egg that happened to get smashed on the back of her head? What are you talking about? And in this case, you need to use more descriptive explanation. In that case, you would use a term such as hematoma. So just reading through this, you notice it sounds a little unprofessional. And here's a much more effective version of a similar report. Obviously, they're including a lot of information that was not included in the other one. That's why I think these two examples aren't all that great. However, actually describes the hematoma to the back of her head, the pain to the back of the head, actually uses a number of medical terms to try and better describe the scene. Okay? Try and learn a couple of terms at a time. Don't try and learn all of the prefixes. Don't try and learn all of the suffixes. Don't try and learn all of the root words. Try and learn a small handful at a time. Utilize them. Pay attention as you're reading reports, as you're writing reports. Ask your preceptors when you're on clinicals about what word might be more appropriate. If you don't have a good medical term to use for something, note cards can be very helpful for this, especially if you're somebody that needs index cards, flashcards to help memorizing stuff like me. Pick a number of terms every day that you want to learn and try and learn. There are more report examples in the book to kind of give you an idea of what to look at. Use Justin's example in the clinical packet. Try and understand some of the medical terms that are used in those. Break them down into their parts, and try and figure out what they mean without necessarily looking them up. There are a number of various medical dictionaries or medical terminology applications that are free for your phone or your computer. There are also some flip books, so little spiral-bound pocket guides with various medical terms, or pocket guides that at least have a good swath of medical terms that you can use at your discretion. One of them, there's an EMS field guide, which will give you about 4 pages worth of notebook-sized pages of various medical terms that you might expect to see. Real quick, I want to see if I can find it for you. I created a list on a class a little while back to describe what terms I thought were going to be most useful to you, or which terms you ought to go ahead and learn immediately, since we're going to be utilizing them so often. Let me see if I can pull that up for you real quick. Okay. I'll go ahead and put this document in our D2L course as well. These are the ones that I think are going to be the most helpful to you to learn soon. So these are various root words that you will see regularly during EMS. There's obviously a much larger list within your book, but these are the ones that I think you really need to make sure you learn as soon as possible. And apparently it did not load properly because I can't see all of the document. So let's try and download it and look at it. There we go. All right. Like I said, I'll load this on the D2L site as soon as I'm finished with this video. But there's all the various root words, number of the prefixes, suffixes that you might be interested in knowing well, and then a nice list of abbreviations that you should expect to see. You should try your best to understand what some of these mean, but I do not expect that you're going to memorize them all by test day, and you're not expected to. Primarily on the test, what it's going to want to do is it may give you a couple words or utilize a couple words that you're going to have to be able to break down to some extent to understand what the question is actually asking. There will be a couple questions about what word might you use to describe blank. Just keep in mind, if you are trying to create or if you're trying to describe something and you don't know what the medical term is, assume that the best terminology, the best language to use is simple objective terminology. In that example on the PowerPoint where it said big old goose egg on the back of her head, don't use colloquial terms like big old goose egg. State an area of swelling on the back of her head, right? You don't necessarily have to know the term hematoma as long as you can objectively describe it. Don't use colloquial terms. Toothache. You can call it a toothache. Everyone knows what a toothache is. You can say that they have tooth pain. You can say that they have shoulder pain, that they have stomach pain, chest pain, that they're having difficulty breathing. You don't necessarily have to use the term dyspnea, though we would prefer that you use the term dyspnea. If you cannot remember what that term is, don't try and come up with a term and just use it without truly understanding what it means. Okay? If y'all have any questions, bring them to me on Tuesday at the lab, and I will try and answer everything I can. Thank you very much.